Right now, somewhere in the world, a 74-year-old woman is sitting in her doctor's office hearing the words, "Your blood pressure looks perfect." She smiles. She feels relieved. She has been taking her pills every morning, watching her sodium, doing everything she was told. And tonight, at 2 a.m., she will get up to use the bathroom, her vision will go dark for 3 seconds, and she will grab the wall just in time to stop herself from hitting the floor. Her blood pressure was perfect. So why is her body failing her? I am Dr. Arya, and for over 25 years I have worked with patients whose lives were changed, not by a disease, but by a number that was never designed for their body. And if you are over 60 and you are taking blood pressure medication right now, I need you to stay with me, because what I am about to share could be the most important health conversation you have this entire year. Let me start with something that might surprise you. The number 120/80, the gold standard that every doctor references, the number printed on charts in every clinic in the country, was never discovered by studying people your age. It came from research conducted primarily on adults in their 40s and 50s. People with young, elastic, flexible arteries, people whose bodies could tolerate lower pressures without any consequence. And for that group, the guideline made perfect sense. Lower pressure meant less strain on the vessels, fewer heart attacks, longer lives. The science was solid, but then something happened that quietly affected the lives of millions of older adults, and almost nobody questioned it. Medicine took that number and applied it to everyone, universally, regardless of age, regardless of how the body had changed. A 48-year-old marathon runner and an 81-year-old grandmother with arthritis in both knees were handed the same target, the same drugs, the same goal. And nobody paused to ask the most obvious question in the room. Does a 75-year-old body actually work the same way as a 45-year-old body? You already know the answer. You live in your body. You feel the difference every single day. But let me show you exactly what is happening inside, because once you see this clearly, you will never look at your blood pressure reading the same way again. After the age of 60, your arteries begin to stiffen. This is not a disease. This is not something you caused. It is a completely natural biological process that happens to every human being who reaches this age. The walls of your blood vessels gradually lose their elasticity, the same way a garden hose left out in the sun for 15 years stops bending the way it once did. When arteries are stiff, your heart has to generate more force to push blood through them. That naturally raises your baseline pressure. This is not your body breaking down. This is your body doing exactly what it needs to do to keep blood flowing to your vital organs. It is an adaptation, not a failure. And here is where this becomes genuinely critical to understand. Deep inside your blood vessels, you have specialized pressure sensors called baroreceptors. Think of them as your body's internal autopilot for blood flow. In a younger person, these sensors are incredibly fast. You stand up from a chair, gravity pulls blood downward toward your legs, and within 1 second your baroreceptors detect the shift, send a signal, and your body compensates. Pressure stabilizes. Blood keeps reaching your brain. You never feel a thing. But after 70, those sensors slow down significantly. The correction that used to happen in 1 second now takes 5, sometimes 6, sometimes 7. And during those critical seconds, your brain, which makes up only 2% of your body weight but demands 20% of your total blood supply every single minute, is simply not getting what it requires. Now, if your resting blood pressure is already sitting at 118 or 115 because your medication has pushed it down to that level, there is no buffer left, no reserve. No margin for error. You stand up in the morning. Gravity pulls blood downward. Your pressure drops momentarily. Your baroreceptors are too slow to catch it, and for 5 or 6 seconds your brain receives less blood than it needs to function properly. You do not necessarily faint. Most people do not. Instead, you feel something subtler, a wave of dizziness, a slight darkening at the edges of your vision, a moment where the world feels unsteady, and then it passes, and you go on with your morning and you tell yourself it was nothing. But it was not nothing. And here is what I see far too often. Most people experiencing exactly what I just described assume it is simply what aging feels like. They mention it in passing at their next appointment. They are told it is normal for their age. The medication dose stays exactly where it is. And slowly, quietly, that person begins to accept a smaller version of their life. A version where they avoid stairs, hold on to furniture when they stand, feel foggy until noon, and believe this is simply the price of growing older. What if it is not? What if the very pill you take every morning to protect your heart is the reason you have not felt like yourself in months? In 2019, researchers published findings in the Journal of the American Medical Association that should have reached every exam room in the country. They studied real adults over 75, followed over real time with real outcomes measured carefully, and what they found was striking. The optimal systolic blood pressure, that top number on your monitor, for this age group was not 120. It was between 130 and 145. That is where they found the lowest mortality, the fewest hospitalizations, and the best cognitive function. not lower, higher. Now let me be very clear about something. I'm not telling you that high blood pressure is suddenly harmless. Uncontrolled hypertension, numbers consistently above 160 or 170, remains dangerous at every age. That reality has not changed. But what has changed is our understanding of where the floor is. There is a threshold below which low blood pressure becomes just as threatening as high pressure. And millions of older adults are being medicated past that threshold right now without anyone telling them. Here is a statistic I need you to hear and remember. Adults over 75 who are treated aggressively to hit targets below 120 have a 28% higher risk of serious falls and fractures. Not a small increase, 28%. And at 78, a fall is not something you walk away from. A fractured hip means emergency surgery, weeks of immobility, risks of blood clots and hospital-acquired infections, and for far too many people, the beginning of a decline they never fully recover from. Here is the part that keeps me up at night. The medication was prescribed to prevent a stroke or a heart attack, a worthy, important goal. But when it pushes pressure too low, it creates the conditions for a fall. And that fall causes exactly the kind of trauma, the brain injury, the cardiovascular stress that the medication was supposed to prevent in the first place. The protection becomes the danger. And nobody connects the two because the fall happens at home in the dark at 6 a.m. and it goes into the medical record as mechanical fall, patient lost balance. That patient did not lose balance. That patient lost blood pressure, and it was entirely preventable. I want you to be honest with yourself right now. Do you feel lightheaded when you get out of bed or stand up from a chair? Do you feel strangely tired in the morning even after a full night of sleep? Has your thinking slowed down? Not dramatically, but just enough that words take a moment longer to find and thoughts slip away mid-sentence? Do your legs feel heavy or uncertain when you first stand? Have you reached for a wall or a door frame in the last few weeks just to steady yourself? If you recognized yourself in two or more of those, I need you to consider a possibility that your doctor may not have raised with you. Those may not be signs of aging at all. They may be signs of over-medication. The medical term is iatrogenic hypertension. It means the treatment itself created a problem that did not exist before, and it happens far more often than the medical system openly acknowledges. So what can you do today, right now, without any special equipment? There is a test I walk every patient over 65 through. It is called the orthostatic blood pressure test, and it takes 5 minutes. Lie down flat and rest quietly for 5 full minutes. Take your blood pressure while lying down and write the number on a piece of paper. Then stand up the way you normally would first thing in the morning, and within 60 seconds take your blood pressure again. Compare the two readings. If your systolic number, the top number, drops by more than 20 points when you stand, that is a clinical red flag. That gap represents the seconds during which your brain is undersupplied and you are one unexpected shift away from a fall. Write those two numbers down. Bring that paper to your doctor. It could be the most important piece of information on the table at your next visit. Let me give you the target ranges that current evidence supports because you deserve to have them written down somewhere accessible. If you are between 65 and 74, a systolic target of 130 to 140 is where the research points. If you are between 75 and 84, that range shifts to 135 to 145. And if you are 85 or older, or if you live with frailty, reduced strength, or a history of falls, the appropriate target may be 140 to 150. These are not careless numbers. They are evidence-based. They are protective. When you see your doctor next, and I want that to be soon, bring 3 questions. First, given my age, what is my individualized blood pressure target, and what evidence supports that specific number? Second, can we test for orthostatic hypotension right here in this office, lying and standing? Third, is there any possibility that my current symptoms could be connected to my medication dose? You are not being difficult by asking these questions. You are being the kind of patient who gets better outcomes, and every good physician will welcome that conversation. I want to close with something that matters more than any number on a chart. Right now, there is someone over 70 who has quietly stopped expecting to feel well. They are tired and foggy and unsteady, and every person around them, including their doctor, has told them this is simply what getting older looks like. For some, that may be true. Bodies do change. But for many of them, far more than medicine has been willing to admit, what they are feeling is not the inevitable cost of age. It is a medication dose that no longer matches their body, and it can be changed. With one honest conversation, one simple test, one adjustment that takes 15 minutes to discuss and could reshape the entire next decade of their life. That is not a small thing. That is everything. If that person might be you, please do not wait. Test your numbers, book the appointment, ask the questions. And if someone you love is over 65, send them this video today. It could be the conversation they did not know they needed. Subscribe to this channel because next week we are going to talk about cholesterol targets after 70. And once again, what your doctor was taught may not be what your body actually needs. You will not want to miss that one. Everything I have shared today is based on current published research and my clinical experience, but it is general health information. not personal medical advice. Your body, your history, and your medications are unique to you. Use what you have learned here to start a better, deeper conversation with your own physician. That partnership is where the real change happens. Take care of yourselves. I will see you next week.